A 90-year-old woman, maybe quite independent, then falls, fractures her hip, is admitted to hospital. At the time, she had a good weight, a healthy BMI. She didn't have any eating problems prior to that. But while she's there, she's of course in pain. She's taking medications for the pain. She's not very mobile. She becomes constipated because of the lack of mobility and the painkillers, which can have that effect. She's not feeling hungry. Nobody pays any attention because she's not underweight. She begins to lose weight. Her muscle mass is reduced from the lack of exercise and the lack of nutrition. Still nobody pays any attention because she's not yet underweight. Her skin starts to get a bit red. People move her about in the bed. They do the pressure care, but again, because she's not underweight, they're still not looking at her weight. And then we find that she starts to get pressure sores. That puts a huge burden on the body, burns loads of fuel to try and heal that. But because she's not eating enough, they get worse, they get infected, she's in pain for longer, the infection spreads to the other wound that's still healing. She ends up in hospital for months and months and months. Eventually she goes home, but she's really institutionalized in the hospital. She's beginning to get a bit confused. That wasn't really apparent before. Her mobility at home is really reduced because of these ongoing sores and problems, and because she's so deconditioned for being in for such a long time. So then she starts to need carers. All of her muscles become weaker, including her swallow, her continence muscles, so she starts to need extra support with toileting. She starts to struggle swallowing old normal textures. She needs modified consistency diet, and it spirals from there. And actually, if we had supported this person right at the start, even when they weren't underweight, but while they were under eating and they weren't fueling their body with the nutrition they needed at that time, if we stopped it there, we could have probably prevented every single one of those consequences. We couldn't have stopped her falling and breaking her leg, but we could have made sure that she healed as well as she possibly could, and she got home as strong as she could be, and everything else was preventable. So unfortunately, there are quite a lot of consequences that can happen if there's no early intervention under those circumstances. So because they could be at increased risk of infection, they could have an infection that's significant enough, like a urine infection or a chest infection, where they need to be admitted to hospital rather than being robust enough to respond to that at home. Equally, being undernourished can increase your risk of falls, and it can also increase the risk of more significant injuries such as fractures if there is a fall. So if that happens and the person is then injured and admitted to hospital, then they're in hospital usually for longer because they're malnourished when they go in. And then when they come home again, they quite often need increased care support compared to what they had before, because quite often during a hospital admission and being unwell, they can lose muscle tone from being less mobile, they can lose confidence, they can become a bit institutionalized sometimes. Sometimes the hospital food isn't always what they would like, not what they're used to. That can be difficult as well and can reduce the amount that they're eating. They can have problems with constipation because of being less mobile and lying down, and gravity not having that effect they would normally have to help the bowels move, which can affect appetite and put people off eating more. So during hospital, it's quite common that people unfortunately lose weight. Also, when you have an infection, or if you have a wound or you have surgery, your body becomes hypermetabolic. That means it burns more calories than it normally would just to keep going and to deal with what's happening to it. So that means you actually need more nourishment, but actually quite often you have less. So the gap between what you need and what you get grows, and therefore the consequences grow as well. So often when people come home from that kind of situation, they are really in quite a high-risk position, and they need to be supported nutritionally as much as possible, as well as with other areas that they might receive, such as physiotherapy or occupational therapy, for example. Things that you could do to try and help would be to make sure that there's a nutritional care plan in place, if that's something that maybe a dietitian is involved with. But even before that level, you can look at what the person's having to eat. Are you noticing half-empty meals? Are there foods going off in the fridge? That kind of thing. Do their rings or clothes look looser? Are they struggling more with activities that they otherwise would have done more confidently? Because overall frailty and loss of confidence is all tied in with nutrition as well as other things. You know, as I say, noticing whether foods have been thrown in the bin, noticing when if you're the next carer that comes in, whether that you're clearing away a half-eaten portion and documenting that, noticing whether food's going off in the fridge, checking the dates, because we don't want people getting food poisoning because they're not eating much and the yogurts have been there for 3 weeks. Noticing, as I say, clothes, if you're dressing someone, are the clothes getting looser and looser, keeping an eye on skin, because if that begins to break down, it can be a sign of malnutrition as well. Really encouraging people. So if you say, what would you like for your lunch today? And they say, I'm not hungry. I know carers don't have a lot of time, but rather than saying, okay, and going, saying, well, you really need to eat. It's really important. You want to keep your strength up. Is there something I could tempt you with? That kind of thing. Or if you're noticing that somebody used to really like scrambled eggs on toast and then consistently they've been saying no for the past couple of weeks, maybe it's worth speaking to family members or speaking to that person to see if you can suggest something else. It's kind of seeing if you can work a bit flexibly with a person. Or also sometimes if people are becoming increasingly confused, you might find that somebody's really able to manage and then suddenly over time they're not. And often carers going in every day, they've got the best view over time of that change. So it might well be that somebody is completely capable of making their own lunch but not, say, their dinner, which is maybe what happens, and the carers bring that in and they're able to maybe make toast and clear it away, and then suddenly that's not happening, and they might well be able to notice signs that that's the case, and they can be the first one to raise that concern that actually, Mrs. So-and-so, I don't think she's doing as well, or the gas being left on, or the fridge being left open, that kind of thing, milk in the kettle, signs that things are just not quite right. As somebody going in every single day, you've got the first-hand sort of view of that.